Elizabeth, I wanted to talk to you, and one of the big concerns is that with this, some people have, as many more of the uninsured become insured, that there will be a shortage of doctors and nurses. Now, working with the Volunteers in Medicine Clinic here in Bloomington, what do you think about that argument?
I think it's a very valid argument that needs to be addressed. We see it locally with the Healthy Indiana plan. A number of people who get accepted into the plan are waiting a great deal of time before they are actually seen by a primary care physician. So it's a problem locally, and I'm sure it's certainly a problem nationally.
And Dr. Stone, if you would, can you tell us a little bit more about Volunteers in Medicine? For those who don't understand, it's here in Bloomington. I know there's one in Columbus. They're all over the state. Tell me, how does it work?
Well, Volunteers in Medicine exists to serve people who have no other insurance options. And so they take care of the people who can't get care anywhere else, and there are income guidelines that have to be met, and they rely in a large extent on the gifts of time and money that the community provides. And physicians and nurses volunteer, but lots of other people volunteer as well. The community, particularly Cook Incorporated, has been very generous, but many other businesses in the community, Bloomington Hospital. It's just been an opportunity, I think, for the entire community to kind of come together and say, we need to do something about the people who can't access health care.
Right, and Elizabeth, I mean, this is one of those programs that was, it wasn't homegrown, but it was kind of homegrown in many ways. It wasn't mandated. Do you see it as a success in terms of helping those uninsured?
Yes, I do. I see that we've increased the numbers of patients that we've been able to see in the last 2 years that we've been open, which has made the opportunities for receiving health care greatly improved in those patients. And in particular, the specialists who accept our patients, that access to that specialty care locally has been a tremendous improvement for the uninsured locally.
Well, we do have a personal story that we want to get to. Let's go to Stan in the radio booth with that. Stan?
That's exactly right, Ann. I think it can be kind of hard sometimes to put a personal face on the struggles that some people have with the healthcare system in America. Jan Reynolds is a resident commissioner of the Bloomington Housing Authority and has had a number of struggles. And I'd like to talk to you about, you had a mom who had cancer, you had
Yes.
a couple of daughters who had some health problems,
Yes.
and you were forced to make some tough choices to see that everybody got the care that they needed. Tell me, first of all, about some of those choices you were forced to make.
Well, at one point, I owned my own home, and I was making a lot of money working for a local attorney. And my youngest daughter had a head injury at school, and then she was also assaulted on the way home one night. So it's kind of like, I didn't really know about the head injury at that time. It was what they call a non-presenting head injury, or a TBI, traumatic brain injury. But things changed. I couldn't really, she was just a different person. So I needed to watch her more carefully. So I took just part-time jobs at that point, and got on food stamps. And then the caseworker at the time said, well, you can get on Medicaid, so you have insurance, which was good. But even then, it's hard to find doctors that know what you're talking about, or take Medicaid, that you really need.
But these problems changed your housing situation. They forced you to sell off some collectibles, some antiques.
Antiques, yes.
To help pay just some of the bills.
Yeah, just so I didn't go into foreclosure with the house, which actually I ended up selling it at a short sale. And that's when I moved to the Hill in Bloomington, and honestly, I thought I was going to be folded, spindled, and mutilated having to move there, but it's been a good experience, and it's income-based. But, and I've always worked part-time, but there again, it's just trying to keep an eye on what's happening, and while she has her own independence, and try to have her make her own choices, still kind of hovering in the background.
Sure. How did you come to view the healthcare system in this country as you were going through all of these troubles?
Frustrating, just from my perspective, in that when you're on Medicaid, a lot of times there's seemingly a time limit where the doctors have like 3 or 4 minutes that they want to spend conversing with you. And if there's something that's obvious, like, oh, my daughter has a sore throat, they'll kind of deal with that, give you the prescription. And the other stuff I had written on the intake form or whatever was kind of like not even discussed.
I'm hoping to end this sort of on an up note. Were there solutions or resources you found, be they through programs or through other people, that made working through this easier on you?
Yes, I mean, there are people out there, and you can change doctors. It's mostly just, you know, word of mouth, and a lot of different agencies can refer you, you know, to different people. So.
Well, Jan, we appreciate your time. Thanks so much for being with us.
Thank you.
And back to you in the studio.
All right, thanks a lot, Stan. Well, now we'd like to further examine Indiana's healthcare policies and plans. The Hoosier State ranked 34th in America's health rankings in 2008, yet ranked last for public health funding. In 2007, more than 1.6 million Hoosiers under the age of 65 went uninsured. So what is the state planning to do to make healthcare more affordable for more people? And we got an email question that kind of goes along with what we're talking about right now. The email question says, I am interested in learning more about Dennis Kucinich's amendment to allow states to establish single-payer health care systems. Is this something Indiana policymakers are considering, and could any Indiana citizens sign up for a public single-payer health care plan? Dr. Stone, why don't we start with you on that?
Well, not yet. They can't sign up. But Representative Kucinich's amendment was passed by the House committee that he's on, which is the House Energy and Something Committee. And so it was passed as an amendment to the bill. Of course, it still has a long way to go, but it's a bill that would make it easier for a state to set up a truly universal, what they call single-payer system, which would cover everybody in the state, and would then really would cover everybody with the efficiencies that could be gained by having a more unified statewide system. Right now, actually, Indiana passed a bill like that in 1993 through the Indiana House, so it's not totally impossible that Indiana might do something like that. But it would be easier with this if this bill goes through, because there are some federal laws, particularly one called ERISA, which make it difficult for a state to do a really big statewide system. And a number of states have looked into this over the last few years. In fact, California has passed a statewide single-payer bill twice in the last 3 years. Each time it was vetoed by Governor Schwarzenegger. So there are definitely some people in the Indiana legislature who'd be very interested in doing something with this if it were to happen, but it's obviously going to take a little while. You know, we just said a lot of numbers right there, and one that stands out to me and to a lot of people, I'm sure, is that Indiana ranks 50th in public health funding. Can we talk about that a little bit, Elizabeth? I mean, you know, you're seeing this on a day-to-day basis, and what do you feel when you hear that number, 50th?
I'm shocked by it, actually. I'm very disappointed also. I wasn't aware of that statistic, and I really am surprised. I know there's a number of community health clinics across the state and free clinics like Volunteers in Medicine. Ours is the only free clinic that does receive public funding through the state, and so we're very fortunate to receive that, but that's a very sad statistic. Yeah,
Nicole, I mean, when you hear that, are you surprised?
I am surprised. I think one thing to remember is that public health funding, are they talking about programs aimed at the community, things like smoking cessation programs, and things like trying to encourage people to eat healthier and to do more exercise? Are we talking about things like, I don't know, bioterrorism preparedness, and what are we talking about with public health funding? But the fact that we're 50th in the nation across the board, that's not a good place to be. And I think, you know, the citizens of Indiana are probably feeling the effects of having not enough funding.
Okay. Well, let's go to Stan now, who is in the radio booth with another guest. Stan?
Thanks, Ann. I'm here with Dr. Jim Bugler. He's the Director Emeritus of the Lugar Center for Rural Health. Thanks for being here.
You're welcome.
I want to talk, first of all, about the challenges that face doctors who are trying to treat patients in rural areas of the state. I know you guys have been working more and more, especially with young up-and-coming doctors to try and tell them, hey, this is an important part of the state too. You don't just need to be in Indianapolis or Bloomington. How are you trying to get that message to young doctors?
Well, in part, you have to select the right students in the first place, and we haven't had a good track record of doing that. In rural areas, basically you're going to find rural kids going back to rural areas, and then their training needs to be different to prepare them for the challenges that you find when you don't have a huge library right next door and specialists around the corner. There are quite a few differences.
So how do you do a better job of choosing these students, or indeed of getting students who may come from a big city background to go into a rural community and perhaps start a private practice or work at a clinic in a rural area? How do you convince them that that's a good way to go?
Well, you probably can't, most of them. And so IU actually is starting a new program in Terre Haute where they are selecting students with rural backgrounds to enter this expansion of the medical school, with the hope that most of those will go back to a rural community, if not their own rural community.
And how do you address some of the problems that are particularly endemic to rural areas, starting with access to care and getting all the way up to some problems? We've seen AIDS, for instance, be a problem in rural communities. How do you deal with the broad spectrum of different problems that affect rural areas versus urban areas?
It's a huge issue, and it's one of the reasons why people don't go and stay in rural areas. One of the best ways of doing that is the concept of the community health center. And those have been expanded. President Bush expanded those, and President Obama has expanded community health centers, which are access to everybody. One of the key things that I had my first opportunity to work with side by side was having a social worker. And having a social worker working with you in a rural area takes so much of the pressure off with some of these very difficult cases.
In just our last 45 seconds or so, sort of a two-part question. What are the problems you see that are increasing in rural communities that need more attention? And are there problems that are being solved better as we go forward here and train more doctors to go into rural communities that you're seeing less of?
Well, the two huge issues in rural areas. Substance abuse, it's endemic. It's probably endemic everywhere, but in rural areas, it's just the emergency rooms in the small rural hospitals aren't prepared to deal with that. There's no counseling readily available. It's a big issue we need to deal with. And then just access to care. The working poor are pretty predominant in the rural areas, and many of those people have no access to health insurance.
Okay, Dr. Jim Bugler, Director Emeritus of the Lugar Center for Rural Health. Thanks for being here.